This video will show us the procedure of placing a dental sealant on a tooth. So the first thing that you are seeing that is happening right now is pumice is being applied to the surface of the tooth to help clean it off. Then after the pumice is applied to the tooth, they will rinse it off with water. To properly place sealants, the area needs to be super dry. So gauze, cotton rolls, and/or dry angles will be placed around the tooth to help keep the area free of saliva. After the area around the tooth is super dry and we know that there will be no saliva contamination, we start. The first thing we use is a blue material called etch. It's applied to the grooves and it's left on there for about 20 to 30 seconds. So we're waiting 20 to 30 seconds. Maybe you'll tell a joke during this time. You don't want the patient to close though, you need to stay open. So we're just waiting, we're waiting. And then finally, when it's time to rinse, we get the suctions in there. Oh, almost time. All right, now it's time. Get the suctions in there and then we rinse with copious amounts of water and make sure that it's removed. We want no more blue on that tooth. So after it's all rinsed away, then the tooth is dried off with the air. The tooth now will have a chalky white appearance, so it's nice and dull looking and ready for the sealant material to be placed. This is the sealant material now being placed into the major grooves of the tooth. So we're just going to kind of watch that sealant material kind of get placed. There you go. And then after that, the clinician may take a micro brush to soak up any excess, and/or the clinician may take an explorer to make sure everything looks good before we light cure the sealant material onto the tooth. Again, still making sure there is no saliva contamination throughout this whole process because the tooth needs to stay dry for the sealant to properly be placed. Now the tooth is being light cured with the blue light, so we wait. After the tooth is cured with the blue light, the last thing they're going to do is check the margins of the sealant and make sure it's nice and sealed. So they're checking the margins with the explorer again. And then they may check the bite with articulation paper. So they'll remove the cotton rolls so the patient can properly bite down. If there are no adjustments to be made, if everything looks good, the clinician will simply evaluate the sealant one last time and you're done. I hope you enjoyed this video. Please like and subscribe if you did. If you want more teeth talk, you can visit my website, teethtalkgirl.com, where we have more articles and videos on specific dental topics. And until next time, peace, love, and teeth.